Hello, and thank you for joining us. I'm at the International Training Center in Las Vegas, where we will reopen in July. Everyone on this webinar has been here before. You've been to the Journeyman Leadership Program, so you know what a great facility this is and the value of the programs we offer. We will start with Train the Trainer programs for instructors from your training centers and with professional development courses for staff from councils, locals, and trust funds. By the fall, we plan to open the center back up for member programs, starting with third-year apprentices. By then, our Canadian brothers and sisters should also be able to join us. This is a critical, important program that helps members who are still near the beginning of their careers understand what it means to be a union carpenter and the role they play in their own success and the success of the union. In line with CDC recommendations and the state of Nevada, we are requiring everybody who comes to the ITC to be fully vaccinated. And I want to thank the hundreds of thousands of members who have gotten their shots. It's because of you that we can reopen. And when we do, no one will have to wear a mask on campus. And we had a question come in during registration from Brother Daniel Heckenthorn. He asked about the best way to show proof of vaccination. You can go to your training center, show your card, and staff will enter it into the system, and it will appear on your training verification card. This will help recruit people for programs at the ITC and when trying to fill jobs that require the vaccine. I understand for some, the vaccine is controversial, but it's necessary to keep our members and your families safe, as well as protect staff who work at the center. I got my vaccine, the Pfizer shot, as soon as I was eligible. I had almost no side effects. I got the shot because I knew that it meant I was safe, and more importantly, that those around me were safe too. Finally, I got the shot because getting as many people as possible vaccinated is the best way to get our economy back on its feet. Whether you lost work because of the COVID-19 restrictions or not, we all suffer when the economy is down. A slow economy means fewer construction jobs and more of our members sitting at home. As journeyman leaders, you play an important role on the job site. And tonight, I'm asking you to help lead the way in getting as many members as possible vaccinated. This will help keep people safe and get the economy back on track. Now, I understand that a lot of members have concerns about the vaccine. Our goal tonight is to talk about those concerns and arm you with the information you need to help us spread the word. That's why I'm honored to welcome a very special guest, Dr. Francis Collins. Dr. Collins is the director of the National Institute of Health in the United States. He has now served that role under 3 different presidents. Before I ask Dr. Collins an opening question, I invite members who were on the webinar to put any questions you have into the Q&A. Dr. Collins, it's an honor to have you join us. Let me kick things off. A lot of our members think they will be fine without the vaccine because they're young and healthy. Doctor, what do you say to them?
Well, Doug, thank you very much for inviting me to be part of this conversation, and good afternoon, good evening to everyone. I'm the director of the National Institutes of Health, which means I oversee the largest supporter of medical research in the whole world, which is our own government-supported National Institutes of Health. You as taxpayers support this effort. And we've been right in the middle of responding to COVID-19 with new ideas about treatments, about diagnostic tests, and most prominently for this evening, the development of vaccines, which have been possible to put out at record speed and are now available. And more than 160 million Americans have received that first vaccination. And now over 50% of Americans have had both doses. I've had a front row seat. In fact, more than a front row seat, I've been in the middle of all of these efforts. So I think I can tell you from the experience I've had that we have never put together vaccines that have had quite the same insistence on rigor as far as safety and efficacy. And it has been an answer to prayer that what's come through this is the resulting vaccines with efficacy of 95% and an extremely reassuring safety record. So we are in a really good position now to help figure out how we can drive this darn virus away. This virus that I keep on my desk here, this model of this coronavirus with those spike proteins on it that enables it to get inside your cells, and where the vaccine basically allows you to generate antibodies that bind all over those spike proteins and keep the virus from getting access. That's how it works. And again, the evidence is this is not only incredibly effective, it's also safe. But I do want to listen today to questions. I think sometimes those of you who are still not sure about this are tired of being lectured to. And I need to do more listening maybe and less lecturing. And I know we have a plan this evening for some of those questions to be posed. And I will do my best to try to give you the best scientific information that we have right now to help guide you with the decision about this, because I think that's what everybody's looking for. And at the end of this program, there are going to be some reference sites there, phone numbers, a website that can give you a lot more information to follow up on. But for now, let's see what the questions are and let's get on with it. Thanks for allowing me to be here.
Thank you. Thank you very much, Doctor. We have Jaime. Jaime, do you have a question?
Yes, my name is Jaime Maguer from Local 213, Los Angeles, California. Thanks for having me on this evening. I've been in the trade for 16 years and we have remained essential and stronger than ever. My question is, how do we really know if this vaccine is safe? It seems like it was done in a hurry.
Well, thank you for that question. Jaime, Doctor?
Yeah, Jaime, that's a question lots of people are asking because it is true that these vaccines were developed in 11 months, and previously this has generally taken several years. So how do we do that? Part of it was this new technology that made it possible with something called mRNA to get started right away, within 24 hours almost, of learning that this was a dangerous coronavirus coming out of Wuhan, China. The design of the vaccine was put together, and in just 60 days, the first person was getting a test injection, what's called a phase 1 trial. That is much faster than it's been possible just because the technology is advanced. We're not growing vaccines in chicken eggs anymore like we did decades ago. The other thing that was done was to make sure that we didn't have long downtimes. I mean, you guys know about that when you're trying to do something experimental, extremely effective when you're putting together a building. Everything has to be sequenced so that you don't end up in a circumstance where all of a sudden, for weeks or months at a time, there's no work to be done. Frankly, vaccines in the past kind of had that problem. This time, the planning was done so that you had a seamless transition from phase 1 to phase 2 to phase 3. That was called Operation Warp Speed. But let me assure you that the testing of these vaccines was more rigorous than has ever been done for a vaccine. For each one of them, at least 30,000 volunteers agreed to take part in the trials. And they were very diverse. 37% of them in the Moderna trial were people of color. So we could really see how this works for everybody. They didn't know when they were in the trial, were they actually getting the real vaccine or were they getting a dummy placebo? Because that's the only way you can figure out whether it's working and whether there are any safety problems. And when all of the data began to emerge along about November of last year, it was much better than I think we had all dreamed of, better than we dared to hope for, with this 95% effectiveness. Now, the FDA then had to look at all that data, and they had a public meeting where all the data was displayed in a very long day where lots of people debated about all the fine points. And ultimately, the experts, none of whom are government employees or company employees, they're just scientific experts, voted to approve. And the CDC agreed with that. So if you go through that track record, I don't think we've ever had vaccines that have gone through this much scrutiny. And yes, it was fast, but didn't you want it to be fast? when hundreds of thousands of people have died. I don't think we wanted Operation Slowboat. We wanted something quick. Maybe warp speed was not the best choice of a term because it did kind of suggest there might be some skipping of steps. Let me tell you from my perspective, and I've been right in the middle of this for the last 16 months, working 24/7 on this, there has never been a more careful effort to be sure we ended up with things that you could trust as being safe and effective.
Thank you, Doctor. We have Heather Daniels on the video. Heather?
Yes, thank you, General President McCarran. My name is Heather, and I'm a member of Industrial Local 2013 in Columbus, Indiana. I'm vaccinated, but still kind of nervous. With no studies of long-term side effects and not officially approved by the FDA, right? How can we be sure there are no long-term side effects in getting vaccinated?
Well, it's a great question. Doctor, what's the difference between the emergency use authorization and approval? And are you seeing any indications of side effects?
That's a great question from Heather, and I think a lot of people are wondering about that. The emergency use approval was put in place so that at a time like this, where we have a global pandemic and people are dying every day, you wouldn't wait for the roughly 2 years that it would normally take for FDA to go through all of the details of a final approval, much of which is sort of about the manufacturing capabilities and so on. In terms of safety, what we do know is that if you're going to have some sort of a side effect from a vaccine, it almost always happens in the first 2 months after the vaccine is injected. And that's why for the emergency use authorization, FDA said they weren't going to grant that until at least half the people in the trial had been injected for at least 2 months. And there was nothing there to worry about. So I think the experience is from the sort of world's experience of vaccines is that it's very unlikely that we will see side effects that are much later than that in appearance. We are watching FDA and CDC both collecting any instances like this to make sure. But so far, it does look very compelling that we have vaccines that are safe and effective. The ultimate approval does require FDA to go through several more months. Pfizer has submitted material for that because they're confident that they have all the evidence to support it. But FDA has not declared when they will actually make that decision. I'm thinking it'll be later this year, but probably pretty close to the end of the year. Meanwhile, I've been injected. I've invited all of the people I know to roll up their sleeves because looking at all the data as a skeptical scientist, I think the evidence that this can help you is overwhelming. And of course, the evidence that COVID-19 can be really harmful to you is also overwhelming. And let me just say one other thing, because I know a lot of you are younger folks who may think of this as not necessarily much of a threat to you. And it is true that the virus is more dangerous for the elderly. But if you look at what's happening right now, now that a lot of older people have gotten vaccinated, who's in the hospital now? It's younger people. And some of them are in the ICU and some of them are dying. It's not as if you're completely off the hook as far as risk. One other thing about that we're learning is that some people who get COVID-19 don't actually get better in a couple of weeks the way you would think. This so-called long hauler syndrome, have you all been reading about that? As many as 10 or 20% of people who get this disease actually have long, persistent symptoms that go on for weeks or months and maybe even years. We don't know. And some of those people are actually disabled, unable to work. And some of those are young people who weren't that sick when they got the acute illness, but now they have this puzzling long-term effect that NIH is intensively studying but don't yet understand. One more reason, the vaccine is probably something to consider because that will also prevent the long hauler problem that now hundreds of thousands of people are struggling with.
Thank you, Doctor. Member Kenyatta Dunlap, we've got a video.
Thank you. I'm here. Thank you, President Karen, and thank you, Dr. Collins, for putting this forum together to inform the membership. My name is Kenyatta Dunlap. I'm a 25-year member of Local 157 in New York City. And my question to you is, if I seen today that over 50% of Americans got vaccinated, and if the vaccinated people are so safe, why should I take the vaccination if it doesn't stop you from getting COVID-19 and I'm perfectly fine without getting the shot? Getting the shot will not prevent me from getting COVID-19, and over 50% of Americans already taking it. Why should I take the vaccination?
So Kenyatta, thanks for the question. Again, a lot of people are asking that. First of all, I do think getting vaccinated does greatly reduce your chance of getting this disease. 95% protection against any symptoms and probably 100% protection against being severely ill and being in the hospital or dying. So if somebody's telling you the vaccine doesn't prevent disease, well, okay, 5% of people may get a symptomatic illness, but they're not going to be very sick. Whereas if you get exposed without the vaccine, you're likely to be very sick or even end up dying from it. So the vaccines are incredibly protective just for yourself. But let me say one other thing. The only way that we are really going to drive this virus out of our communities, out of our country, is basically by getting enough people immune so that the virus has no more people to pick on. That's called herd immunity. And it will take something like 75, 80% of us immunized before that happens. Now, maybe that's something that's like somebody else's problem, but think about this. There are people, maybe 5% of us, for whom the vaccine will not generate a good response because they have a kidney transplant, and so their immune system is suppressed, or they have cancer and they're on chemotherapy, which is suppressing their immune system. They're very vulnerable. Their hope for not catching this disease and being able to live a normal life again is that all of us will take it upon ourselves to be the ones to get immunized and to achieve that level, that blanket of protection of immunity across the whole country so that it'd be safe for them. This is a love your neighbor moment. It's about yourself, to be sure. It can protect you, but it's also a way to protect those around us who are most vulnerable. Aren't we all called to do that in some way? So if you've been waiting to see what to do here, think about that. After all, the first people who got these vaccines in the big trials, that's been now close to a year. They're all doing really well. The evidence suggests this really works and it's really safe. Maybe if you're deciding to wait and see, it's time to decide you've seen and stop waiting and roll up your sleeve. And it's easy now to get vaccinated. If your block in your plan is that you're just not sure where to go or how to get this done, at the end of this program, we'll tell you exactly how to find places that are within 5 miles of you that have vaccines ready to go, and you don't even need an appointment.
Thank you, Doctor. We have a question that came through registration. Paul Hutchins from Washington State asked if we will be requiring participants at the ITC to wear masks and whether or not we are requiring a specific vaccine. Let me answer the first part. Participants that come to the center will be required to be totally vaccinated, and they will not have to wear masks while they're here. Dr. Collins, you can answer that second part of that first part of the question.
So again, I think what you're describing there is certainly that a lot of businesses are having to figure out how to deal with this situation. I was on the Late Show with Stephen Colbert on Monday night, and he was just announcing that he was going to have his theater open again in about 3 weeks, but only if people are vaccinated, because he's worried otherwise that they would crowd together and there would be an outbreak. Again, the federal government is not going to require vaccinations. There's not going to be a vaccine passport, but employers may very well make that decision, and nobody is telling them what's the right way or the wrong way. They just have to sort of figure out what's going to work. And I would think in your businesses, construction sites, jobs, many employers probably will think the safest way to be sure that the job can go forward and there won't be many people sick is to actually ask everybody to get vaccinated. That's not my decision to make, that's theirs. But I do think more and more of that is going to be happening. So I got to say one more thing. People I think who have been reluctant to get vaccinated probably feel a little bit like you're under all this pressure and why should I do this? Let me give you one really positive thing. You know, when I got vaccinated and my wife did, we went through our 2 doses and then our 2 weeks of waiting for it to take full effect. Now we are protected. I can go outside without a mask on and not worry about it. I can invite other couples who are immunized to come to my house and we can have dinner together and we can laugh and we can hug each other at the end of the evening. This is liberating. And I don't know, even those who are not sure about the vaccine, this has been a heck of a tough year. We've all been living under this cloud of uncertainty and a sense of fear. This is how you drive fear away. That's what this vaccine can do. And so don't miss out on that opportunity either. It's a chance to really be liberated, to enjoy the dividend of freedom that the vaccine can give you.
Thank you, Doctor. We have Neil Mulrooney, member on video here. Neil?
Thank you, General President. My name is Neil Mulrooney. I'm a member of Partners Local 579 in Newfoundland and Labrador. I hear there can be complications for people with allergies. And there's members of my family who have allergies. And I was just wondering, is the vaccination safe for them? And, how can I know that they aren't going to have an adverse reaction to the vaccine?
Well, hello, Neil. Hello, Newfoundland. Hello, Canada. Great question. There are people who have had very serious allergic reactions in the past, something called anaphylaxis, where it is an immediate allergic reaction, sometimes to a drug or a bee sting or some other injection, where you actually have trouble breathing and you break out in hives. This is not like, oh, I got kind of a head cold. This is something much more serious and sudden. People with that history should identify themselves when they come to be vaccinated so they can be watched closely, and they're asked to stay for 30 minutes after the shot instead of 15. There are rare examples of people who have had that reaction from the vaccination. Most of them, people who've had previous serious reactions like this from other things. But it's not a contraindication to getting the vaccine. We know exactly how to treat that when it happens. It involves an injection of epinephrine. Many of those people carry around an EpiPen. So if that's somebody in your family, reassure them. They can talk to their doc. But I still think when you add up the benefits and the risk, the vaccine is a pretty good deal.
Thank you, Doctor. Our next question comes from Steve Young from Pennsylvania. Steve wants to know if someone cannot get the COVID-19 vaccine due to religious or medical reasons, will they be allowed an exemption?
So I guess that will depend a lot on the employer. In terms of religious exemptions, I know there are people who do have concerns about whether the vaccines have been produced in a way that might be offensive to them in terms of their concerns about fetal tissue. There are rumors out there that there are fetal cells in the vaccines. There are not fetal cells in the vaccines. One of the vaccines, the Johnson & Johnson vaccine, is prepared in a cell line that was derived 40 or 50 years ago from an aborted fetus in Scandinavia. So the cell line's been carried just in Petri dishes for the last 40 or 50 years. The Catholic Church has looked at this and does not feel that is a reason for pro-life individuals to pass up the chance to be vaccinated, since it can be life-saving. The other vaccines that are available in the US, the Pfizer and the Moderna, have no such connection to fetal lines for their preparation. And so there's no reason on a religious grounds or a pro-life grounds to be concerned about that. In terms of medical concerns, there are very few reasons medically that this kind of vaccine should not be considered valuable to everybody, unless you had a specific, very severe allergy to one of the components of the vaccine itself, which almost nobody has had because they're so new and they're made in a new way. So again, if somebody has that kind of concern and can lay out exactly the reasons for it, I'm sure employers would want to look at that and figure out what to do with it.
Very good. Thank you, Doctor. This will be our last question. We've got a video from April Crownhart. April?
Hello, and thank you, General President McCarran. My name is April, and I am a member of the Southern States Millwright Regional Council of Local 1263 in Georgia. Do you think employers are going to require the vaccine? And if so, will they be responsible for any lost time due to side effects of the shot, or if there are any long-term effects?
You know, I don't know how many employers will require the vaccine, but the best thing you can do is get vaccinated so you don't have to worry about if that comes about with an employer. And Dr. Collins, are you aware of any decision by Osha or whether or not employers will require employees to be vaccinated being held responsible for side effects of the vaccine?
So I appreciate April's question. And again, I'm not an expert in what employers are going to decide to do. And some probably will, because of concerns about safety, require that. And also their concerns about not having a lot of people out sick. Because boy, you get a big outbreak of COVID-19 in unvaccinated employees, and it can really do serious damage to your progress. And as you said, Doug, at the beginning, this is what we really don't want to have happen for our economy. We need to get this back on track and get everybody at work and not have these events happening, these super spreader events, which if people aren't vaccinated can still be happening. In terms of OSHA, I know OSHA has issued a guidance that if employers do decide that they're going to mandate vaccines, then if somebody suffers a vaccine event, like having a serious consequence of going to the hospital, which we don't expect to happen more than once in a very rare circumstance, that has to be notified to OSHA. And I assume that has consequences, although I don't know the law very well in terms of compensation. If somebody has a sore arm and still is able to come to work, well, that's not a big deal. When I had my shot, I had a sore arm and I was a little chilly. I had a little headache that first 24 hours, but I kept working, and I suspect most of you all would have as well in that circumstance. If people need to take a day off because they're really chilly and feverish after one of those vaccine doses, and if it's been mandated, then the employer has to make a record of that to OSHA. If, on the other hand, the employer has basically suggested it, urged it, but not mandated, then those kinds of requirements of posting don't seem to happen. That's about as much as I know about it, Doug, unless you have other things to add.
No, that's very good.
Okay.
Thank you.
Well, I very much appreciate the chance to be part of your program this evening, and I know we're running up against our half hour. I just want to wish everybody the best of luck in trying to sort out through these issues. Again, you're going to see in a minute here or so the kind of information sources that you might want to look up, things like vaccines.gov and a text message that you can send to find out where vaccines are available to you. And if you really want to know what's happening across the country with people joining up to try to understand this, join the COVID-19 Community Corps. Just go to Google and type in "We Can Do This," and you will get information about how to join that effort as a community is doing all over the country. And I think that's a really good way to learn more about answers to the questions that you all have asked. These have been great questions. I'm really glad I had a chance to join you this evening.
Thank you, Dr. Collins, and thank you for joining us tonight. This has been very helpful, and I hope the members who are with us tonight feel more confident about the shot. For all our journeyman leaders, I urge you to talk to your coworkers about what you've learned here tonight. Thanks again to all the hundreds of thousands of members who've already been vaccinated. And for everybody else, we are putting some information on the screen about how you can find where to get your shot. The more people we get vaccinated, the safer everyone else will be. And the faster we can get our countries open and the economy back on track. Let me just say one more time to our members, getting vaccinated is safe and effective. And I encourage you to get out and get that done. So that hopefully we can see you back here at the International Training Center for another program. Until then, thanks for joining us. I hope our Canadian brothers and sisters enjoy their Victoria Day holiday earlier this week, and that our U.S. members enjoy the upcoming Memorial Day. Take care, be safe, and good night.